Dear all, it's a number of weeks since we last did an update video, and that's because we've been not receiving any questions into the COVID Q&A inbox. However, there are a couple of developments that we want to share with you that we feel that are very important and relevant to our frontline care staff. The first area that I want to update you on is with regards to enhancements to sick pay. As you may have seen on Facebook and on other media, the government have introduced something called the Social Care Support Fund, and this allows for temporary top-ups to organisational sick pay for those that are off with COVID-related absence. Now, previously the Mungo Foundation had committed to providing a top-up to contractual pay, and we did this from the 1st of May. However, following the government announcement and in discussion with UNISON, we are now committing to pay sick pay based on an employee's average earnings, and this allows us to include payments such as sleepover and overtime. Now, the fund has been made available as it's recognised that employees may or have faced financial hardship because of COVID-related absence, and the additional top-up will only be paid in these circumstances from the 23rd of March until the fund closes, which we anticipate will be the end of September. We will write to all affected employees to provide further clarification and details of the written confirmation that we need to receive in order to be able to pay these additional monies. Now, due to the extensive analysis required to make these calculations, and because of staff shortages in both HR and finance, it is going to take us a couple of months to complete this work. However, please be assured that we will backdate all relevant payments so that employees get what they are due. The next area I want to talk about is workplace testing. Regular testing for COVID-19 has been defined as a public health measure necessary to protect both staff and vulnerable service users. Scottish Government and Health Protection Scotland are rolling out Test and Protect programme, and you're asked to participate in this even if you have no symptoms. Care workers should have received a letter sent on the 24th of June from the Cabinet Secretary for Health and Sport and COSLA, which contains important information. If you haven't already received that, we'll put a link to the letter in an email to be sent to you shortly. Now, as employers, we have a responsibility to make sure that staff are fit for the duties they perform and have appropriate procedures in place for the prevention and control of infection. This includes supporting workers to take part in the National Test and Protect programme. Now, we understand that many of you may be worried about taking the test for various reasons, including whether your pay will go down if you have to self-isolate. So I can confirm that this will not be the case, as we will tap into the fund that I've explained previously. At the moment, testing is only within care home settings, and we have agreed in line with SSC guidance and in discussions with UNISON that if any staff member chooses not to participate in the testing, then they would be asked to move to another project where there are less vulnerable individuals. If you have any questions with regards to testing, please do raise these in the first instance with your line manager. Thank you all for taking the time to listen to these important points, and may I take this opportunity on behalf of the senior management team to thank you all for your hard work and commitment, particularly during these very challenging times. Thanks.